We now need to move to public comment. Thank you, Dr. Cohan. I always forget that. So I will now move to the public comment. So were a number of individuals that wish to speak. They were determined by lottery. And so at the onset, I'd like to welcome and thank our public comment speakers for addressing the committee today. We appreciate your presence here at the meeting. All speakers today submitted a request in advance of the meeting, and the final list of public commenters was determined via lottery. For the speakers, we have a limited period of time allocated for public comment. In order to make it through all of the listed speakers, it is extremely important that each speaker limits his or her comments to 3 minutes. We will be displaying a timer on the screen so that you know how much time is left. For the audience, I want to make the following comments. Public input and engagement is vital to the work of the ACIP. We really appreciate it. We expect all attendees to treat every commenter respectfully before, during, and after their comments, and not to interrupt or otherwise disrupt the public comments process. To minimize disruptions, please remain in your seats while the speaker is talking. People who are disruptive to the meeting will be asked to leave the meeting room. Again, we wish to thank our speakers, and we look forward to your comments. I will say thank you very much. Your time has expired as you come to 3 minutes. At an extension of over 3 minutes and 30 seconds. I will say, as a courtesy to other speakers, we ask that you conclude your comment. And finally, at 4 minutes, your microphone will be shut off with the statement, "Your comment time has ended. Thank you very much." So, we will begin. Our first speaker is Lynette Baron. Ms. Baron, to the microphone.
Hello, ACIP. Thank you for letting us come back and allowing the public to be a part of these meetings. I always like to thank you for that because we definitely like to be able to come in and listen to all of this and kind of see what's going on and what's being added, what's being voted on. One of the things that I kind of wanted to talk about, and I probably won't even need 3 minutes, is just some of the things you guys do recommend on your website. You can go to cdc.gov and you can look up the recommendations for your child's first baby foods. You're to introduce one food at a time, 3 to 5 days in between these baby foods. Could be apples, bananas, whatever. And you are told to look for severe allergic reactions. You're told what to avoid. You're told if your family has a history of reactions to these type of foods to be sure you're looking out for it or avoid them altogether. You're told so many different things. You're told not to ever give 2 types of food in one day because there could be a reaction and you're not sure which food did that. But then you go cdc.gov, same website, and you look at the vaccine schedule. Same age range, 4 to 6 months. You're getting 6 to 8 vaccines in a day. You have a reaction. Not only do they not believe you've had a reaction, but they also have no clue which vaccine it was because they're giving you so many in one sitting. I can't understand how we are, as parents, told from the same website to spread out our apples and bananas 3 to 5 days in between them, but it's okay to give all these vaccines with all these different antigens and adjuvants and neurotoxins and all these things. We all can go to your website and see are in them, and give them that many in one sitting. I can't wrap my head around that. And I don't understand how any of you who make these recommendations could see that apples could be possibly more dangerous combined with bananas than formaldehyde and aluminum or any of these other things. How can you recommend to spread out your baby foods 3 to 5 days in between, but not your vaccinations? I mean, this is the most confusing recommendations. I hear you guys do an hour worth of wordplay on the word recommend before. How do we say recommended without saying recommended? You're recommending we spread out baby foods, but you're not recommending that they spread out vaccinations with all these ingredients in them. To me, that's just the most insane thought. Like, you're all doctors. Like, y'all don't think that's insane? That is the most mind-blowing thing to me, that I'm supposed to separate my apples and bananas for a reaction. So I know if it was the apples or bananas, but I'm not supposed to spread out all this stuff. How much sense does that make? I mean, that's my question for you today. And I'd like to ask all the people who came here from who I've invited, please be respectful during this entire public comment time. Thank you, guys.
Thank you very much for your comments. Our next speaker will be Kevin Tuttle. Mr. Tuttle.
Hi, I'm Kevin Tuttle, a former Air Force officer, father of two, as well as president of the Adverse Events Recovery and Information Center, which helps fund recovery to the people injured by your decisions. I sat down the other day to watch Netflix, and as happens to every middle-aged man, I decided to watch a World War II documentary. It occurred to me that while watching this, that you people are going to be in a heap of trouble when the Nuremberg tribunal-like trials happen here, after your crimes against humanity are uncovered. Because what history shows us is that truth prevails. My grandmother survived a Nazi regime that eventually crumbled due to what the world finally saw was happening, mass murder. Your tyrannical regime is also crumbling. The people are rising up against this slow Holocaust you're inflicting upon us. You can't hide the truth from parents who have witnessed vaccine harm. I read this week that your buddies at the WHO recently revised how adverse events after vaccination are classified, so that if a child with a heart condition, for example, gets vaccinated and then dies, it was his heart condition that caused his death and not the vaccine. Isn't that convenient? Tell me how that's ethical. It's shocking how a product that isn't safety tested, isn't tested for carcinogenicity or mutagenicity, and has no liability can be so revered amongst medical professionals. What you call science is simply marketing, and people are seeing through it. For instance, people know that acute flaccid paralysis is polio, triggered by the oral polio vaccine. Changing the name doesn't change the condition. Your lies are being uncovered. The lies that come from this board and the CDC cause far more sickness and death than measles, chickenpox, whooping cough, and all the other diseases there are vaccines for combined. Let's take a look at some of your lies. Your slogan of safe and effective. The definition of safe is protected from or not exposed to danger or risk. Effective means successful in producing a desired or intended result. Clearly, your products aren't safe since the Supreme Court ruled they were unavoidably unsafe, and countless testimonies prove their danger. I can only presume your intended outcome is to injure and kill, so I'll let you have the effective portion of that. You should be sued for misleading advertising. When you tell patients that they need Gardasil or they will get HPV, that is a lie. When you say the flu shot is the best way to protect yourself from the flu, that is a lie. When you tell the new mother that her baby is in danger unless it receives the Hep B moments after birth, that is a lie. Vaccines don't cause autism. That is a lie. Remember the Tuskegee experiment. Their lives could have been saved. But those in authority watched them suffer and did nothing to help, much like the Nazi leadership. How is what you're doing here any different? Your lies are catching up with you. I'd start worrying about that trial.
Thank you for your comments. Our next speaker is Erica Gesser. Ms. Gesser?
Is it okay to adjust or? Shorter than everybody else. Story of my life. Hello, good afternoon, beautiful people. Thank you for your time. I'm so excited to be here. This is not my first time speaking. I really wanted to speak a lot from the heart, so a lot of this was kind of written on the fly today. I like to think we're all here for the same reasons, right? For the health of our nation, our children, and future generations. It's hard to believe there could be people like me, right, that don't support a life-saving product. It just doesn't make any sense, does it? Logically, I'm a person of logic. Someone that takes a vacation day from work to sit in rush hour traffic to attend a meeting like this, that's me. In fact, some travel much farther than myself, and they spend a lot of hard-earned money, okay, to attend. Many that are here in support of vaccines, on the flip side, are paid to be here as a part of their job. They get their travel expensed, and they have some financial ties or incentive to these products. This is one of the most important synchronicities I hope you guys will ponder on, logically. This is not a coincidence. I simply don't believe in coincidences anymore, only winks from God or cause and effect situations. Don't get me wrong, I'm working to but I'm a servant of God, okay, through serving the people. I attend these meetings representing the sweet angel babies, and I'm honored to be a voice for the voiceless. These victims are listed on my dress here. I wear this dress every time I come. It represents America, freedom, patriotism, our human rights, and justice and truth. And these families and these sweet angel babies deserve justice for the loss of life and tragedy that your recommendations can create and do create. The repeated mantra of vaccines are safe and effective, it must stop. There's something very important missing from what you do here in assessing risk and versus benefit. The presence of God, the universe, and natural law. How can you honestly determine effectiveness and risks when there is no way to determine who would even get the virus or disease, that is, if they're even going to be exposed to it? We're really playing a lot of God here, guys. How about a focus on controlling and understanding the chronic illnesses and mystery deaths happening? We have so much technology and resources, but we can't understand or find a reason behind why healthy babies are dying. SIDS, autism, autoimmune issues, gastrointestinal issues, mental health issues, the list of mysterious health ailments, they go on and on. They've affected me personally and my family. Meanwhile, you have an avalanche of citizens coming forward saying they noticed a correlation of these issues happening after shots, and their cries are being met with hatred, division, and government mandates. Instead of sound investigation, many doctors are in denial about adverse events, and the reporting system is broken. Per the Harvard Pilgrim study, you can look it up, done by the HHS, it's showing that less than 1% of adverse events are even reported into the system. We have multiple vaccine injuries in my family, and they have yet to be reported. My Graham got IBS after the rabies shot. My son and I both had serious adverse events to Hep B. My mom, transverse myelitis after the flu shot. This has to stop, guys. Stop calling it rare. Stop saying this doesn't happen. The system is broken. We must fix it, and we ask for your help with this. I know that you're all here for the right reasons. Please join me. Thank you.
Thank you for your comments. Next speaker is Ms. Laura Ciminelli.
Hello. To vaccinate with confidence, the strategic framework to strengthen public trust, it's a fail. The gladiatorial claim that only CDC, ACIP, WHO, and their affiliates alone have expertise is outrageous. This dismisses the equally educated scientists and doctors who question the current vaccine schedule. Parents who reject or dare to question this schedule are slandered as misinformed, a public global health threat, or discredited as anti-vax. We've blindly followed your vaccine schedule. We read the one-page vaccine information statement until our children succumbed to the adverse reaction not listed on it. Your vaccine statement does not equate informed consent, which means informed of all risk and benefits on the pharmaceutical insert, like seizures, ADEM, SIDS, encephalopathy, and the flu gives flu-like symptoms. We're never told about those. I hear your boast. The science is settled and the vaccines are safe and effective, except they're not. Fully vaccinated communities have outbreaks of mumps and whooping cough often. Your flu shot efficacy never hits the mark. Yet now you say get two. One doesn't work, so get two. What kind of science is that? Your science is gravely outdated. Autism statistics 1 in 59. Data collected 2014. You might want to check your calendars. Instead of worrying about global health threats, look at the autism rate. I tell you, my grandson's school had one self-contained autism class, which there's 4, but your data's 2014. It's not a national crisis. It's not like vaccines don't contribute. Dr. Shannon Cronin orchestrated an esteemed panel of scientists and MDs in Atlanta in 2018. One conversation, one of those esteemed doctors is in your audience, to be a debate on the risk and benefits of your schedule. Last minute, the proponents bailed. Are you that confident that vaccines are beneficial, safe, and effective with low risk, why is open discussion refused and denied? This increases my lack of trust. I watch nationally as legislators push your schedule, along with the media, ramrodding over our freedom of religion rights to say no to your vaccine schedule. Defining my God by the constraints of a denominational box, this is not how the framers penned it in the Constitution. Public trust is not achieved through censorship, coercion,
Thank
or
you for your
threatening loss
comments.
of
Your time has
daycare or
expired.
free public education for our children. It is not. Proverbs 31:8, your fail has increased us exponentially. Please look.
Thank you very much. Our next speaker is Kendra Severino.
Hi, Tia Severino, Luke's mom. In February 2018, I watched this panel unanimously approve the new Hepatislav B vaccine for hepatitis B. This vaccine contains a new adjuvant that has not been tested with other vaccines. It is completely unknown how it will interact with adjuvants currently being used. Questions were asked about this, and your secretary stated that, generally speaking, vaccines can be given at the same time as other vaccines, but should be given in a different limb. Giving vaccines in different limbs does nothing to stop them from mixing in the body. This is common sense. Yet this ridiculous notion was accepted by this panel. Everyone voted yes. After voting, one of you did express concerns about the heart attacks in the trials and asked when information would be available from the public data surveillance system. The answer? It'll require people to be using the vaccine. This vaccine was rejected twice by the FDA, but now that you approved it for market, our children, the public, get to be experimented on. I have a problem with that. You should have a problem with that. Patients must be told about all potential risks with medical procedures. But for 3 years, the public has not been told that they're part of a test group. Here's an example. I have a friend named Isaac Lindenberger. He said I could talk about his experience. After his younger brother Ethan's story became a national conversation, Isaac decided to get his vaccines for college. He went to the health department. They gave him 6 vaccines, 3 in each arm. One of them was your new Hepatislav B vaccine. Isaac was not told that this was a brand new vaccine that came with a heart attack risk, that it had never been tested with other vaccines. He has no way of knowing what the long-term risks are for him. You know, your suggestion to give it in another limb, even that wasn't done. They gave it in the same arm with 2 other vaccines. So like it or not, Isaac's part of your test group. Will he develop heart disease or autoimmune issues from this experimental vaccine? If he does, who's going to be held accountable? Nobody's liable. They make them, you approve them, and then you wipe your hands clean. But guess what? We're awake. We're watching you. Your efforts to censor us, all your propaganda and your labels, they're failing. People are waking up, and we're not going away. Thank you.
Thank you for your comments. Ms. Karen Ernst, please.
Hi, thank you. My name is Karen Ernst. I am Director of Voices for Vaccines. And I'm here today because of many reasons, but primarily because it's altogether possible that the chickenpox vaccine saved my child's life. He was 10 days old when his older brother was exposed to chickenpox in his classroom. His older brother, of course, was vaccinated. Chickenpox didn't come home to us. And the possibly catastrophic effects of chickenpox on a 10-day-old baby is something we never experienced. So it's possible that the chickenpox vaccine saved his life, but we don't know that. I don't know if the measles vaccine saved my life. My mother doesn't know if the polio vaccine saved her life. My grandmother doesn't know if a diphtheria vaccine saved her life. And my great grandparents will have no idea if a smallpox vaccine saved their lives. And in fact, when you go about doing your business, you have no idea whose lives you're saving. You can't go into the world and say, there's a child who would have succumbed to measles were it not for the work that I do at ACIP. And when you go forth, you spend a lot of time doing that work. I think all of the discussion about the Ebola vaccine that we had this morning really shows us truly how much work goes into ACIP recommendations. The months and months and months, and I heard sometimes all-nighters that go into work groups, the years of research and data collection that happens all over the world, all of this comes together. And we know that in 20 years of giving vaccines, that those vaccines have saved approximately 732,000 lives in the United States and 21 million hospitalizations. We just don't know who those kids are. And so we can't come here and tell their stories. But I want to assure you that the work that you do when you're looking at saving lives and building those numbers and really making sure that we have soccer teams full of kids, we've got classrooms full of kids, we have families full of kids, that those things continue to occur because of the recommendations that we're making for immunizing our children on time. I'm grateful for those recommendations. I'm really grateful I vaccinated my kid against chickenpox, and I'm very grateful that my children are completely up to date on vaccines and that nothing's happened, and that's really the story of your success. We get vaccinated and nothing happens. I will just make a plea that when you're doing all that work as work groups, you sort of let us know how much time was put into this, because I think that makes a big difference, and thank you very much.
Thank you for those comments. Our next speaker is Anisha Marlon.
I am here as the mother of a vaccine-injured child and a family support professional for 9 years. I'm here on behalf of the families struggling that may come across this video and question just enough to do their own research. If you are a parent in the age group that received maybe 10 vaccines like I did, but despite the number of now recommended being above 69 doses, you believe and still say that your fully vaccinated child is just fine. Just fine except for the chronic ear infections and the reoccurring strep throat that maybe even required surgery. Just fine except the severe eczema, the depression, the anxiety, the type 1 diabetes, the ADHD, or the autoimmune diagnosis that they don't know how to heal. All of these by the age of 7. I urge you to research. Only then will you find that the science isn't settled and the one-size-fits-all model is flawed. We need to be aware that when we get vaccines, we are consenting to be part of the post-market data. Parents deserve to know the risks. 54% of children in America are now diagnosed with a chronic illness, an illness that's dependent on a pharmaceutical product. How convenient for their pockets. This is the pandemic you should be nonstop finding answers for. By 2025, the cost of autism alone will be more than over $1 trillion, more than the defense budget. I urge you to truly research this. Even if you lose your funding and donations, parents deserve to know. If you choose not to, I hope and pray that you sleep well at night and that your retirement plans are worth it. The families affected by this growing statistic do not have that luxury.
Thank you for your comments. Ms. Savannah Starkey, please.
I want to thank you for the opportunity to come here today, first and foremost. I didn't come here today in hopes that my story would somehow touch your heart. I have seen you ignore the 10,000 victims before my son, and I have seen you ignore the thousands of victims after him. But instead, I came here today to make history, because one day you will not be able to ignore these injuries and these deaths any longer. But most importantly, I came here today to honor my son, baby Remy. When I see Remy again, I will be able to tell him that I did not give up on him and that I did not give up on the truth. Remy passed away 6 months ago, approximately 12 hours after he received his CDC recommended vaccinations at his 2-month appointment. The autopsy came back anaphylactic adverse reaction to the multiple vaccinations received the day prior, and black and white, clear as day, listed as a concerning condition directly resulting in my son's death. Remy had MTHFR, which is a gene mutation that affects the body's ability to detox and get rid of neurotoxins that are ingested, inhaled, and injected. MTHFR affects the essential process of methylation. Folate is an important vitamin that your body needs to start the methylation process. Individuals with MTHFR have problems absorbing folate, leaving them deficient, ultimately hindering the methylation process. Methylation increases sulfation and the production of the master antioxidant glycothone. These two aid in excreting heavy metals, toxins, and pathogens out of the body. Without this essential process, you are at risk for adverse reactions and toxicity, up to and including death. It is known that 1/3 of the population have an MTHFR mutation, and it is speculated that more than half have some variation of MTHFR. Coroners are refusing to do simple post-mortem ward tests to see if the deceased is positive for MTHFR. Coroners are not even testing the brains of these infants, which is where we all know the adverse reactions happen. How can you say that vaccines are safe when no testing is being done on healthy infants that pass away hours after they receive a vaccination, or 8 of them? Better yet, why are we not doing genetic testing on every infant prior to any vaccinations? This would not fix the epidemic that you all have helped create, but it would be a good starting point.
Thank you for your comments. Next speaker is Mr. James Neu-Ashwander, please.
Once again, it's Dr. James Neu-Ashwander. I'm a physician duly board certified in emergency and integrative medicine with over 30 years of experience caring for chronically ill children and adults. I have personally witnessed vaccine injuries in my career as an emergency room physician, and I can tell you it is not rare, and certainly more than 1 in a million. I've also heard hundreds and thousands of stories from parents and patients who will swear that it was a vaccine that caused their children's autism, autoimmunity, asthma, or other chronic illness. And I'm here today to tell you you're losing the confidence of those people and the healthcare practitioners that care for them when it comes to vaccine safety. I stood here in October and challenged this committee, the CDC, the NIH, anybody that would listen to a public debate on vaccine safety. And I can tell you my phone has not been ringing off the hook. So there's certainly a need for far greater vaccine safety research. Without that science, we can't have good communication. We can't repurpose the same old science because it's going to make things look better. We need more investment in vaccine safety science. Those are not my words. Those are the words of Heidi Larson, who is the director of the World Health Organization's Vaccine Confidence Project. So in 2013, the Institute of Medicine was tasked with the job of determining the safety of the entire vaccine schedule. What they found was there wasn't any evidence. There was no study comparing the health outcomes of a vaccinated population to a completely unvaccinated population. In response, the CDC created a committee of experts to determine how could you ethically do this study using current databases like the Vaccine Safety Data Link, the VSD. The result was a 2015 white paper in which they outlined the 20 most concerning health conditions along with details on how to do each of these studies. They even gave a specific example of how to use the VSD to study how the schedule affected a child's risk of asthma. That was 5 years ago. Nothing has happened. We're all still waiting. Do the study. If you want the statement, vaccines are safe and effective, to be anything more than an advertising campaign, you need this kind of science. And if you're unwilling or unable to do this, please step aside and give people like me access to the VSD. We'll make sure those studies are done. My God. Dr. Larson also pointed out that the vaccine hesitant are winning people to their side at a much greater rate than the vaccine confident. They're 5 times more likely to go to the other side. You're losing that battle. She also pointed out that there's a wobbly front line of health professionals that are questioning vaccine and vaccine safety. She said this is a huge problem that you can do something about. You guys have the power, and I'd like to remind you of the first ACIP committee meeting in 1964. Part of that committee meeting challenged this committee to responsibly advise for new projects and research. I think it's time to step into that responsibility. Please do the studies. Thank you.
Next speaker is Ms. Deborah Wexler, please.
Good afternoon. I'm Deborah Wexler, family physician and executive director of the Immunization Action Coalition in St. Paul, Minnesota. I would like to say some words about access to vaccination today, because I think it remains a problem for many people who live in our country, and I hope we can do more to address it. IAC got started after the measles epidemic in 1990, when across our nation, 166 people, primarily very young minority children in poor neighborhoods, died, and 11,000 were hospitalized. Measles took a big toll in the Twin Cities, and everyone in public health worked long hours to stop it. We had hundreds of children infected with measles. 3 of our city's Hmong refugee children died within a few days of each other in May of 1990, all around 1 year of age. These children were generally unvaccinated for many reasons. Making an appointment was difficult if you didn't speak English, lack of transportation to a clinic, and fear of receiving a bill was always present. There was no Vaccines for Children program then. So how did we stop measles in 1990 in our city? St. Paul Public Health led the charge, and this is the 50 people who were part of that charge. They and many others throughout the city helped, including my federally qualified health center, La Clinica. We held weekly walk-in immunization clinics, days and evenings, throughout the city in public housing projects, community centers, WIC clinics, and in churches that served meals to the hungry. There were always nurses and multilingual staff on site to talk to people to vaccinate them on the spot, and many other cities did the same. And that's how many undervaccinated communities became protected against measles in 1990. Local public health departments were going out to the people. Thank you, local public health, for all you did. But today, access problems continue, with clinics still not easy to get to, language barriers, lack of health insurance, and reluctance to seek care for fear of deportation. And as we all know, today there is a serious compounding factor that did not exist 30 years ago, the prevalence of anti-vaccine messaging. I think that we as healthcare professionals should once again be working closely with local public health to determine strategies for providing direct immunization services in underserved neighborhoods and ethnic communities where vaccination rates are low. 30 years ago, I saw up close and personally the power of such an approach in protecting the lives of children. Thank you.
Thank you for your comments. Next speaker is Ms. Sandy Spidey.
I'd like to begin by quoting Colossians chapter 3, verse 23. Whatever you do, work at it with all your heart, as working for the Lord, not for human masters. Ponder that. Ask yourself, who am I serving? Am I truly serving the needs of the public and working for the greater good? Am I doing all that I can to ensure safe and effective vaccines for everyone? Am I serving God and doing what is right in His eyes? Or has the pharmaceutical industry become my master? Listen, y'all, I had a very eye-opening dinner with Dr. Paul Offit this past October. I questioned Paul about the Hep B shot for newborns. He said, and I quote, "Babies need the Hep B shot because, for instance, mom brings baby home from the hospital and Uncle Joe comes to visit and sneezes on the baby." I kid you not, that's what he said. I was absolutely shocked. After a few seconds, I recovered and said, "Wait a minute, Paul, hold up. Does Uncle Joe have a nosebleed?" He changed the subject. Does Paul truly believe Hep B is transmitted via sneezing? Doubtful. A quick search on the CDC website verifies that it's not. Or does he realize that there is no legitimate reason to vaccinate all babies for Hep B? So he just rattled off some crap. This exchange is just one illustration of why we no longer trust our doctors. Also, we don't trust you, the ACIP members, to make wise recommendations for the vaccine schedule. Honestly, the schedule needs to be scrapped. You can start by removing that Hep B vaccine. That's a change we could all get behind. We are fed up. We are sick and tired of you all smugly ignoring every testimony that comes before you. How can you sit here and listen to anguished parents telling you about their babies who have died and their injured children and continue to vote yes on every new recommendation? How do you sleep at night? You are perpetrating crimes against humanity, truly. You don't care about the wide varied genetics of these babies. You treat them like cookies going down an assembly line, all being punched with the same cookie cutter. You know that medicine is not and cannot be a one-size-fits-all approach. Yet when it comes to vaccines, you lose all rational thought. What in the heck are you doing? Hear me loud, hear me clear. Your gig is up. The public is no longer deceived. You've lost our trust and all credibility. Think long and hard about what you're doing and ask God to open your eyes and heart to the real truth about vaccines. Face the facts. Vaccines are harming children at an alarming rate. Give up that old, tired sales pitch that vaccines are safe and effective. Quit denying the injuries and deaths. Stop saying adverse events are 1 in a million.
Thank you for your comments. Your time has expired.
Listen to the mothers, fathers, and grandparents who are screaming at the top of our lungs, "Vaccines harmed or killed my child." I don't think too many of you are concerned with serving God. I think you are primarily concerned about money. All you ever do is add to the schedule, add to the schedule, add to the schedule to make more money. I challenge you today, prove me wrong. Prove me wrong by rescinding your recommendation for the
As a
hepatitis
courtesy
B
to other
birth
speakers,
dose.
your time has expired.
There is
We ask you
no
to finish.
justification for Hep B at birth other than money. Rescind that recommendation.
Thank you for your comment. Our next speaker is Marcy Flickinger.
Hello, and thank you for allowing me to speak to all of you again. My status of being a concerned citizen and mother to 3 children from Pennsylvania has not changed, but how I've chosen to address all of you most certainly has. I do not want to be labeled an anti-vaxxer nor a troublemaker. Rather, I'd like to be seen as a change maker and for you to be known as the solution creators. But in order to facilitate change, we must face the hard facts. According to the CDC's website, infant mortality rates in the United States are consistently higher than equally well-developed countries. We can all agree that infant mortality rates gauge how healthy we are as a society. I cannot help but to ask, why are we so behind? One would think that with all the vaccine hesitancy, the top 3 reasons for infant deaths, or maybe in America, would be measles, mumps, or maybe even pertussis. Instead, it's congenital abnormality, premature birth, and SIDS. On one hand, the CDC's website boasts about how SIDS rates have drastically decreased since the Back to Sleep campaign. And yet, if you continue reading, they eventually mention how undetermined and accidental suffocation rates at the same time have equally risen. This perplexed me, so naturally I did some digging, and I found that the ICD codes have been reclassified from SIDS to undetermined, accidental, etc. Isn't the collected data how we monitor vaccine safety? Maybe this could be attributing to the fact that we still don't know what causes SIDS. Speaking of data, according to the VAERS database, there have been over 8,000 deaths reported after recent vaccination. Almost half of those deaths were children under the age of 6. 3,600 were under the age of 1. 789 of those under 1 died the day after their shots. 2,273 deaths occurred within 7 days of their vaccinations. Dr. Gregory Poland, vaccinologist, professor of medicine at the Mayo Clinic and director of research at the Mayo Clinic, states that vaccine development has followed the one-size-fits-all approach. Unfortunately, we are reaching diminishing returns. More funding needs to be allocated towards his genetic research in the individualized vaccinology. Precision medicine is the new frontier. Why aren't we using these same methods when it comes to vaccines? We can all attest to the fact that there's a subset of non-responders walking around thinking they are immune, and equally beside them are the adverse reactors who are now ex-vaxxers. Why not address this now using the same advances in genetic discoveries? Just like way back when, taking mercury out of the vaccines just to appease us mothers. Can you do the same by start building a genetic database, starting with these dying babies? I'm no doctor nor scientist, but I say it's time we catch up to modern medicine, start compiling the genetic data so you can finally create a solution to these very serious events. And her name was Evie Gail Clobez. And your vaccine schedule killed my friend's baby.
Thank you for your comments. Next speaker is KJ Moore.
Hi, KJ Moore, third time's the charm, Carpe Diem nursing, traveling nurse. Vaccinations are the leading cause of coincidences worldwide. Correlation doesn't equal causation until it does. Science so settled it has a market worth $58.4 billion by 2024, and its flaws deliberately covered up. Science so settled, but we still don't know what causes autism. Vaccines so safe, the National Institute of Health study from 1994 titled Death reveals that the Vaccine Safety Committee was charged with assessing a causal relationship between all of the vaccines it reviewed and deaths reported to the VAERS vaccine reporting system. To answer the question, can any deaths be attributed to the use of vaccines discussed in this review? The fluoride is working. You don't remember the study? It even mentions the Cutter incident, a well-known example of vaccine contamination caused by errors in quality control by the manufacturer and lack of clear guidelines, where several people died. Ask me about that. In another case, in 1991, several deaths were reported following administration of measles vax in India. Look at Somalia last year. Very same thing. No cases of measles until they started vaccinating, and then boom, everyone started dying. We have science so settled, babies die from SIDS or VIDS, vaccine induced. always 24 to 48 hours after their pediatrician vaccinated them. How come it's never 24 to 48 hours before they went to their doctor? Correlation doesn't equal causation until it does. Science so settled, measles and mumps went from being a rite of passage that gave you immunity to certain cancers. I guarantee more than 50% of this room and their parents and their grandparents survived measles. How'd you get here? But now my children can't opt out of a live virus that this study says could cause systemic infection that could be fatal. That's from your study, National Institute of Health. I can send you the link. Vaccines so safe, the adverse effects are death. Death! Vaccines so safe, glyphosate, a cancer-causing ingredient also known as Roundup, has been found contaminated in all vaccines. Vaccines so effective that entire schools and military ships are quarantined with measles or mumps or whooping cough. Every single person is vaccinated. Vaccinated. The vaccine epidemic has gotten out of hand. It's time we stop ignoring the real science. It's right there on Google, but you guys are censoring it because you don't want the truth getting out because of your billion-dollar market. How come they haven't sued you for that? Vaccines are safe and effective is a slogan. They can sue you for using false advertising. We should do a class action lawsuit.
Thank you for your comments. Your time has expired.
Thanks.
Our next speaker is Lauren Cohan.
Good afternoon. I have attended a number of these meetings, both in person and watching live online, and I have witnessed countless parents standing here pleading for you to listen to their stories of their children who were injured or killed by the products you arbitrarily recommend here. And I have watched in agony as members of this committee have played on their phones and held conversations during these parents' heartfelt pleas for your recognition and consideration. That is why I am not here to talk about my own son's vaccine injury. I use the term arbitrary to describe your recommendations because I have reviewed your grade table provided for your consideration of each vaccine presented and noticed a section on risk versus benefit. If you were truly considering the risk-benefit factors, you wouldn't be able to recommend many of the vaccines that you add to the schedule each meeting because the numbers do not hold up to this assessment. For example, in June of 2019, Prevnar 13 was reviewed for further recommendation, and it was discussed that over 28,000 individuals needed to be vaccinated to prevent one case. Now consider that the population of the US ages 65 and above is roughly 49 million. If all 49 million of those individuals were vaccinated, the vaccine would only prevent roughly 1,750 cases of the disease each year. Now consider the VAERS reports for Prevnar 13 in just 2018 for that same population is 2,470. I am not a math genius, but even children can see that the adverse reports are higher than the potential number of cases prevented. It's no secret that Harvard found that less than 1% of adverse events are reported, and we know that not everyone will be vaccinated, so the numbers are even further skewed in the risk over benefit factor, which makes your recommendation for continued use nothing more than arbitrary. Next, consider the meningococcal B vaccine being mandated in several states for entry into college. The incidence of the virus in the US has been on a rapid decline despite the minimal uptake of use of the vaccine in college-age groups, with consideration that this committee acknowledges the waning efficacy after 2 years, rendering childhood vaccination ineffective. In 2018 alone, there were only 330 reports of the virus in the US, but in the same year, there were 978 adverse reported events for the MenB vaccine. Again, risk versus benefit does not add up to support the recommendation of this vaccine. The numbers are similar for several of the vaccines on the current schedule, but my time up here prevents me from continuing, so I will leave you with this. I have watched as countless attendees have begged you to study the science further, but since you seem to find science to be a matter of opinion, I'm going to ask you to do the math, because numbers don't lie.
Thank you for your comments. That ends the public comment session. The voting committee wishes to thank you all for your thoughtful comments. We will now take a 15-minute break.